Ladies and gentlemen, thank you for tuning in to the 16th episode of Rowen Reports with Dr. Robert J. Rowen. Today, we welcome Dr. Dennis Harper to the show. He has an extensive medical and political background and is an innovator in ozone therapy, including using ozone in chiropractic and naturopathic care. If you'd like to learn more about Dr. Harper and his practice, there's a link to his website in the description of this podcast. Let us know what you think in the comments of this video. And if you'd like to support this podcast, please visit our generous sponsors by following the links in the description below. Don't forget to use the promo codes for discounts on every order. Now, I would like to leave you with some words by Paracelsus. The art of healing comes from nature, not from the physician. Therefore, the physician must come from nature with an open mind. Before we jump in, we would like to give a special thank you to our sponsor, PROMOLIFE, bringing you closer to the benefits of ozone therapy. Proudly rooted in the USA, PROMOLIFE is at the forefront of assembling ozone therapy generators designed for both personal and professional use right here on American soil. Meticulously handcrafted and precision calibrated, each ozone generator speaks quality and reliability. PROMOLIFE has simplified the ozone therapy process by offering a complete line of high-quality accessories that allow you to use ozone in ways you never thought possible. Don't miss out and explore the entire collection of cutting-edge offerings at www.promolife.com/ozone. Make sure you use the coupon code in the description of this podcast for an exclusive discount towards your journey to enhanced well-being. I am also excited that our friends at shopc60.com are helping to sponsor this podcast. If you haven't heard of C60 before, also known as Carbon 60, it is a powerful antioxidant that helps to optimize mitochondrial function, fight inflammation, and neutralize toxic free radicals. I am a big fan of using C60 in conjunction with a keto and intermittent fasting lifestyle to support the immune system, help the body detox, and increase energy and mental clarity. If you are over the age of 40 and you'd like to kick fatigue and brain fog to the curb this year, visit shopc60.com and use the coupon code in the description for 15% off your first order and take control over your health today. This episode is also brought to you by Simply O3. Did you know ozone therapy has been a transformative and medical approach for over 100 years? Used for enhancing immune function, boosting energy, and improving blood flow, it's a powerhouse for maintaining health. Today, over 2,500 medical studies back its benefits, and it's especially effective before workouts, reducing fatigue. Curious to try? Visit simply03.com and explore the world of ozone therapy. Use the code in the description of this podcast for 10% off everything they offer, like the Simply O3 3.0 Complete Kit. Begin your journey to better health today. And last, but certainly not least, this episode is brought to you by NORDIC Health Solutions. Founded in Annapolis, Maryland in 2009, NORDIC Health Solutions is a leading biological medicine company offering a diverse range of healing modalities. Their devices provide the body with energy and tools needed for healing, repair, and disease prevention through pulse electromagnetic frequencies, light, temperature, and gases. NORDIC Health Solutions devices excel in both energy medicine and in light medicine, aka photobiomodulation, and the red light bed offers unmatched power and frequencies at half the price of the competitors. And the Hercules Smart Thermal Laser is exceptional for pain management. Their motto is to outpower and undercut the costs of the competition. Finally, ozone therapy, including home ozone generators and the renowned Zotzman Ozone Hyperbaric High Dose 2000 for clinical use, delivers impressive results. Physicians can attend quarterly ozone training workshops in Santa Rosa, California with Dr. Rowen and Dr. Sue. Learn more about NORDIC Health Solutions and their mission at www.nordichealthsolution.com. All right, ladies and gentlemen, welcome back to the 16th episode of Rowen Reports. We have Dr. Dennis Harper on the show here. Dr. Rowen, I'll let you introduce him.
Thank you. Dr. Dennis Harper is a healer in Idaho. He's got several degrees, including chiropractic and naturopathic. And I met him many, many years ago at ozone meetings and found out that he was doing some very innovative work. I've watched him work. He's a teacher, and I've seen him do extraordinary things at meetings on participants, including relieving pain instantly. And I've asked him to come on to explain a couple things to our audience. One is his method of relieving pain, which is an instant relief. And another is he's got some unique methods of using ozone over target organs to help those organs recover and regenerate. Dr. Harper, did I leave anything out with regard to your background?
Just like dead cow. Other than that, we're good to go.
You're
Robert.
a meat eater. I'm not. They all know that.
I know. I just got to give you grief on that one, Robert. Always have, always will. So that and a good shot of whiskey.
Okay.
So it's all good to go.
So tell us about your unique methods of pain relief and improving body function.
Well, we're talking to a lot of lay people and some doctors here. So I think what's interesting about it is the history. I think we've lost a lot of history over the years in healthcare. There was things going back into the 30s and 40s that were highly effective that we've lost. And new science, new drugs, new surgeries, we think it's better. And it's not. It's a joke. It's expensive. It's not effective. So what challenged me years ago was when I started in chiropractic. And to say, as you're saying there, I've been in practice now going on 45 years. So I started into healthcare 50 years ago. And what healthcare was then and what it is now is not the same animal. People's health is different. How we get there is different. And I truly believe stress is a big deal. It's really, really, really bothering a lot of people, more ingrained than they think it is. And so when I looked at pain, I looked at some old chiropractic paradigms, and one was up, down, inside, out, which means the nervous system flows from the brain, down, outside, back, and up again. So you're monitoring where things are all the time, whether you're in a hot room or a cold room, or you're on a slippery slope, or your foot slipping, or you got pain somewhere. You're monitoring that whole system. Some of the old papers I read on chiropractic and becomes really interesting because they actually took back in the early 80s. I read a paper, and I cannot find the paper. I apologize for that. They took and injected oxygen, just oxygen, parallel in the spine. And they found they got the same results they got from a chiropractic adjustment. And you think, wow, that's interesting. Why did it do that? So in simplified terms, it did what we could do with an adjustment. What's an adjustment do? What's the oxygen do? So what it does, it actually causes a stretching sensation in the nerves, which causes what's called spinal level impulse to the spine, and affects what's called the mechanoreceptors. The mechanoreceptors allow you to sit the way you're sitting there, Lucas and Robert. So you can sit there because mechanoreceptors are telling you where your equilibrium is all the time. So if you have an injury to the back or an organ, it refers to the spine. And it affects the mechanoreceptors in a compensatory method to protect those. So it may hold you at a grind like this or this like that, or you may be pinching a nerve down the spine, down the leg, or to an organ, heart, liver, lungs, any one of those. So now the mechanoreceptors, we've put that oxygen to the side of it or adjust it at that point in time. We get to stretch the nervous system. It goes to the mechanoreceptors, and it goes up the spine to the brain, and then resets your equilibrium point. So it like flips the computer off and back on again. So when I thought about that more and more over the years, I saw some therapies using procaine to numb the nerves and get sort of a similar response. And then about 8 years ago, we got asked to go to Cuba. Well, Cuba has no drugs, but they do ozone. So I thought, well, let me experiment with ozone instead of procaine to see if I get better results. It's cheaper, easier, quicker. And the results were phenomenally better. And I tested that with a system of having a major lymphoma, cancer with lymphoma in a patient. So lymph nodes were all swollen. And I found with MS patients also swelling in the brain. And they do a procedure where they actually drain the fluid out of the brain and do a surgery on the brain to relieve pressure in the brain. It costs $50,000 for the procedure. But I found that if you do these injections, and I did procaine on one side and ozone on the other side, the ozone got like 5 times better response than the procaine for draining the lymph nodes. So it obviously was affecting the nervous system at a much higher rate and more effectively. So I went down to the spine and I found different areas that I could affect the system. So if I do an evaluation on someone, I find leg pain, shoulder pain, foot pain, things like that, and I test the body to make it actually feel the pain. Then when I reset the adrenal glands on the system or those spinal receptors, it erases that pain away. Now, if a problem is there, it comes back. For instance, if you have a knife stuck in your back, I did that, maybe we relieve the pain for a minute or two, but it's going to come back because there's a knife there. Same thing if you have a piece of bone sitting on a disc in the back, it's going to come back. But what I found with it, it caused a dramatic change in circulation to that area and actually able to heal people up. And what got my attention years ago, I did a patient with sciatic pain. He was scheduled for surgery the next week. And I did the neural responses on the spine, a lot of the foot, a lot of the hip. Pain was gone immediately. He came back a year later, canceled the surgery, did not have surgery. We tuned it up 1 year later, never had surgery on his back. So they found in pain a lot of times, I know I'm talking a lot of things at once here, but pain a lot of times is 50% from the brain, not from the area you feel the pain. So if you reset the nervous system to process the pain and reset that computer, a lot of the pain goes away. When patients come in with 3 to 5 or 10 symptoms, then I'm going, okay, something needs to change here because something's affecting your system to have this many symptoms. And I can inject all little spots or reset the whole computer and see what comes back after I check it within 2 minutes. And a lot of times we see 80% reduction of pain in less than 2 minutes. There's 10% that have a serious problem that can't be affected by that. That won't change. But for 80% of the people that have no pain within 2 minutes when they come in the office is highly beneficial. So I'll get people with low back pain. I'll set some of those little nerve spots just under the skin, just a little bleb of ozone in places on the skin. And all of a sudden they straighten up, they stand up, I can adjust them, they go out of the office happy. And so what's going on with the ozone and what does it do? Ozone's an amazing, it's a highly unstable gas. And it's different if you put deep in the muscle or in a joint or an IV or under the skin. When I put it under the skin in these patterns, it causes stretching, burning effect, and oxidative treatments. So it's a different response there than if you did a 2-inch needle into the low back, for instance, and inject it. So what I found with that ozone does all the things. And as we know, what stimulates the nerve? Cutting, burning, stretching. And that's what I'm doing. So I'm doing all the magic with the ozone in that specific way of doing it. And there's lots of uses of ozone, which we can talk about, but that's one thing that's really the most simple, easiest way to see affects the ozone. And I got an idea about this probably 10 years ago when I saw doctors from Italy doing MS patients where they'd shoot ozone on every spinal segment of the spine and do that and stimulate it. Well, I found if you don't go as deep and go shallower, you get even better results than what they were getting with less injections.
That just for our viewers are familiar with my writings on a discipline called neural therapy, and that goes back more than 100 years to Germany, where they injected tiny amounts, tiny blebs, mosquito bites of a local anesthetic along the spine or elsewhere, and had enormous effects. And it's written about in a book called Manual of Neural Therapy, according to Huneke. It sounds like yours is an improvement 100 years later on this.
And that's why we call it neuro-ozone therapy, because it's ozone therapy with nervous neurotherapy. And I think it's simpler, easier, and less spots to inject. Where they may shoot 20 places on the spine, I would shoot 5 and get the same results. And the trick is understanding what you're trying to accomplish. You mentioned about affecting organs. So for instance, if I went to a prostate that was swollen, I would shoot L3 and L4 in the spine, go around the side, shoot over the pubic symphysis and lateral to cause that energy to go to the prostate. Liver, I'd find the liver meridian, go around the side of the liver, clear to the front, and do that to stimulate liver. Lungs, heart, same thing. So you can stimulate those areas. And, in a lot of cases, it's not going to fix anything. But a lot of times you need that little boost, 5 or 10%, 15%. And you got to be realistic about what you're going to try to accomplish. But if you can do something that can reliably get people over that hump to start healing, that's worth a lot mentally and physically for them. Because if you can't get them to change their mental state, you physically can't get them better. And you know that as well as I do, Robert. It's just not going to happen. They can cause themselves to be sick. So you got to break that whole cycle of them getting sick up. And this is something that seems to work really well to do that. And it's so cheap and easy to do and quick. And you see results immediately. And you talk about doing the muscle testing with it. We muscle test with it before and after to check them. And we see patients are always shocked when they have no pain and now their arms and legs are strong. And they're like,
it is a shock.
It
is a shock to them. Yeah. Anybody who does ozone or this work.
Yep. So that's one thing. It's a blessing with it. And it's simple if you think about it. And that's where it becomes difficult because we try to overthink, overcomplicate, and make things really difficult instead of simple. And I think that's where healthcare has gone off the rails with this. It's like, oh, let's do an MRI, we'll do a special cardiac test, and we'll do all this stuff. And, it has a place, don't get me wrong. But is it overutilized? Way too much. And I think that's where the diagnostic skills of the doctor is extremely important to sort through all the crap. When a patient brings in, a file this thick of stuff, and you go, but why are you here today? Well, my hands are swelling, my feet are swelling, I feel like crap, my joints ache all over. Let's go back to basics here. Let's change your nutrition, do a little detox on you, do some simple IV treatments, and let's get your body back in line. We'll set your adrenals and keep those in line. And a lot of people miss the basics that can make a huge difference in that person's health. And I see it all the time. I know you do also, Robert.
You did two things that both Terry and I were very impressed with, and that was resetting the adrenal and the thyroid. And Terry just handed me a note asking me to ask you if you've seen let's pick the thyroid, for example, because more people are on thyroid than adrenal, and it's a crisis in the country. When you reset the thyroid, do you see people able to shed their thyroid meds or reduce the dose or get rid of, say, Hashimoto's?
It changes it. So yes, but it changes. What's amazing about it is how, and I see ones where people are having trouble swallowing, for instance, their thyroid swollen, and no one's ever checked it. I mean, no one, and I know you palpate thyroids now, but most doctors do not even palpate a thyroid.
Most doctors don't even examine, put their hands on their patients.
Touch people, right? And so, I found what's really amazing about it is I've had swelling reduced by 75% within 3 minutes after injecting it, with that pattern of 5 shots there. Scent and smell back. So what got my attention with it originally was when COVID and people were losing scent and smell. And so I found in probably 60% of the people, even if they lost it for a year, within an hour get 80% of the scent and smell back after doing that injection over thyroid. So it's affecting a lot more than just the thyroid. It affects that whole maxillary system in the whole mouth and different area of sensory nerves. Like I said, I think there's so much we don't understand. If we're willing to look out of the box, we see things that we didn't realize we could affect so effectively. And I think we have to realize how amazing the human body is if we open pathways, give it energy, and reset that nervous system so that it can be back. I call it a neurological limp. So, and you talk about thyroid, whether it's Hashimoto's or it's from COVID affecting thyroid. If that happens and the COVID is gone or the insult to cause Hashimoto's is gone, the body remembers Hashimoto's or thyroid loss of scent, and it remembers that and thinks that's a norm. So when we erase that nervous system, it takes that norm away and the body can restore back to natural function. Now, if it's damaged, it'll cause more circulation to go there, cause it to heal more. So it gives you a leg up no matter which way you go with it. But I do lots of thyroids that are swollen inflamed, that people are on medications and able to reduce medications and get the swelling down, and they function better. But I'll be honest, Robert, I think our society is so contaminated, I don't think there's a cure for anything anymore. I think we're managing the body as we go along now. And it's been a hard reality because I wanted to fix everything and found out that it doesn't exist anymore. We're managing.
That's a really honorable statement. And Dennis, I totally agree with you. We're poisoned beyond belief. Our soils are depleted. The stress has gone way up. And how can people heal with that no matter what we do?
You can't. I've really realized and tell people we're on a long-going maintenance program where we're going to dodge problems. I've had people come in and said, "Did you ever had this pain before?" I said, "Yeah, I've never been this old before either." So it's like, and again, that's like you and I have been at this a few years, and you get your eyes opened or you do the same thing you did 20 years ago. And both of us don't do things the way we did them 20 years ago. Other people would take my class and they go, "Gee, I've been 3 years I took your class. What are you doing different now?" It's like, it's not even the same class. It's like, it's just a whole nother animal than what it used to be. And healthcare is that way now too. It's a whole nother animal. We need to be realistic about that. We need to open our eyes to that.
Speaking of that, there are some professionals that watch this podcast, and there are lay people too. Can you give them a link to get to your teachings?
Easy. Start at harperozone.com and you'll come up to our two websites. We have HRS website and the other one that has all the videos on it. We have almost 100 videos on a video library you can buy. It's $95 a month, and we're adding 2 to 3 videos a month now on. I just added one on injecting the Heberdine's node with ozone, and that was kind of entertaining. But it got better within a day. So things like that we've added on, and it's just fun what you can find that you can inject that you never thought you could inject before. And I'm obviously not too afraid of much of anything with trying new things, as you know, Robert. But I do it safely. I'm not a cowboy at it. I do have some guidelines somewhere. I just don't know where they are, but they're somewhere out there. I have boundaries.
How about adrenal? Have you seen people actually see their adrenal glands, say, recover and function properly when you do these?
We see.
And again, for the viewer, we're talking about raising a little bump of gas in the skin over the organ. Go ahead.
What has to happen to get adrenals to balance is we can reset them. They'll feel great. It'll help depression, a whole bunch of stuff for 2 to 5 days. So I put them automatically on an adrenal support. We use OHS adrenal support, and I put them on 2 a day. And I found a lot of people are able to hold their adrenals by just doing that. And I get them off all the processed foods they can, pops and sodas, heavy alcohols, things like that. I really have them reduce that. And they have to be part of this. I learned a long time ago, my other thing I've got is the fact that I'm not fixing anybody. Your body's going to fix you. You better be in charge of it and responsible for it. For me to be responsible, go talk to somebody else. And so I'm really drawing a line with that. And people understand that. So you're going to do this, and every 6 months we'll tune things up or check things out from there. But I think it becomes a really important thing. And stress, like you mentioned earlier, Robert, also, and I also mentioned, is like a weight over everybody's head all the time now. And it's really not a pleasant place. So you've got to find a happy spot. And that's one thing we could talk about a little bit, is finding your happy spot. I found doctors are the sickest group I treat. And you see when I go to seminars, same with you, they'll come to get treated. Do they get treated on their own? No, they don't. They wait a year to see me at a class to get treated. I said, you need to do something. Well, we're just waiting for you. No, get off your tail and be aggressive and pursue some stuff that works for you. And you cannot get well without putting some effort out. And I think one of the things I tell people to do is find really good dirt time, where they go find a really peaceful place, even for a half hour a week, to get someplace that can clear their head, totally reconnect to the earth and the energy of the universe. and calm themselves and find out what's driving them. And so I have lots of little tools. My book, I wrote a book. It's called Solving Life by Dr. Dennis Harper. It's on Amazon. You can buy it. It's $10. But it talks a lot about some of these methods of just getting yourself balanced back again and how we can actually drive ourselves nuts with life. And it's just not a good place to be at.
How does, when somebody comes to see you, now you're way out in the boonies in Idaho, when somebody comes to see you, how is your evaluation different than, say, the conventional medical doctor? Now, I know the answer to that. I want the viewer to see that.
So what happens, I get people every week that fly in or drive in or from 6 hours to around the world to see me. I try to discourage them from coming, and I tell them to go find a practitioner by yourself, and I'll help that if we can help or do that. What I get concerned about, I'll be really blunt about this. I've had several patients in the last 6 months that had called me. They knew I was and called me and said, okay, this doctor's recommending $30,000 of IVs for 1 month. I'm going, whoa, stop. Well, stop right there. What are they treating? Well, they think I have this or think I have that. Well, that's not good enough for me. So I will take and have them send me blood work. I'll talk to them about basic nutrition. I put them on off all the garbage, refined foods, any of the label on them, I want them to quit eating for 3 weeks before they come to see me. And they've got to do that before I even see them. I put them on some D3, some K2, and some magnesium. Basic stuff they should be taking anyhow. And then I'll see them. So they walk in the door. I usually have them stay 3 days. Monday, Tuesday, Wednesday, sometimes Thursday, depends on the condition. The first day I'll do an evaluation. And my evaluation and consultation really does not take that long. I do a 4-minute exam, which gets 57 orthopedic neurological tests in 4 minutes. So I generally know chemically, musculoskeletal, and neuromuscularly where their body stands. And then I say, okay, why are you here today? I found this and this and this with you. Oh my God, I never realized that was happening. And sometimes a major problem, the minor problem is a major one. The ones they complain about is a minor problem as opposed to what's causing the minor problem or the major problem. So when I go through that exam, I go, what about this? Oh yeah, I didn't tell you about that. Why didn't you tell me? Well, I didn't think it was important. It's like, oh my God. So I think that physical exam opens a lot of doors. And patients are like, oh yeah, you're right about this. I did this one's wrong. This was a problem. And then we determine their care. And in a lot of cases, we'll do the neurotherapy the first time on them that evening. If we have a deeper injection to do, like in the spine or the neck or shoulder, we'll do those that night. The next day, we schedule them for an IV. We do IV jump starts with the amino acids and peptides we use. And then I'll check them the next day. And if we're doing a biological allograft stem cell procedure, we do that. Sometimes the first evening or second day, depends on what the patient condition is. I had a patient from Seattle that came over. He's in his mid-30s. He had 2 heart surgeries. They wanted to put in a pacemaker and a defibrillator in. His infraction rate was like 25 or 30. And
you mean his ejection fraction?
Ejection fraction, yeah. I'm sorry about that.
Yeah.
Was 30. So we did neurotherapy. We did cells on him. We did an IV jumpstart. And within 2 weeks, it went up to 50. So it took him out of that whole level. So, I mean, he said his scar improved that he had on his chest. So the patient came over from Seattle, and since he's done so well, his family said, you look amazing. Your heart test is now at 50. You're not on the surgery list anymore. We don't need to see you for 6 months. He feels great. He's got more energy. And now he sent most of his family over. So I've actually talked to them about doing ozone on their own there with just the ear insufflation, just to help them get by when they don't get to come over here. So I've got them lined up to get an ear insufflation machine full of families, 8 or 10 of them from Seattle. And
this is interesting. Who's taking credit for their improvement? Is the medical doctor taking credit?
No, they don't say a word. They don't even comment on it. No, they don't say a word. They say, oh, it's better. That's good. That's it. I've had them throw the x-rays at them and all sorts of stuff. Patients go, That happens sometimes. They get better. It's like, okay.
I don't know that we see a lot of heart patients. I don't know that I've ever seen a patient with congestive heart failure get better on his own with conventional medicine. I
Never
think
they
they
get
just
worse.
wait for the.
No,
Yeah.
they get worse. They never get better.
So
That's pretty much the standard.
yeah, and the majority of our cases get better too. Overwhelming majority, but no one gets 100%, and that's going to be due to the circumstances and the environment for a large
It's
part.
management. It's management. Yep. I
Now
don't
you
perceive to get anybody better. We're going to manage your cases.
mhm.
I've
You
really learned that.
mentioned
It's really been a
ear.
safeguard for that to say that. It's like, we're going to get you as well as we can get you, and then you're in charge of maintaining this with us.
You mentioned ear insufflation. That's a really simple ozone method. I'd like you to expound on that a little bit because everybody can do that.
Well, it's something we used one from our one machine and did it, but it was noisy and loud for people. So we went to Dennis's machine, Momika's, and we're using 120 gamma ozone for 15 minutes, and we're seeing amazing results with it because it's very defined down to a small volume, and it's extracted, so it's not in the air in the office. And patients love it, and I got several buying our machines for home. And I think it's
Okay,
probably, I don't know, we can argue with that, but I think you probably get 60 to 80% of the results you would with a single UVB ozone treatment, and it costs them way less, and they can own their own machine.
Before we jump back into our discussion, I want to remind you about the amazing health benefits of ozone therapy with Simply O3's home systems. Imagine feeling increased well-being, sharper mental clarity, and less inflammation after just one treatment. The Simply O3 3.0 Complete Kit lets you experience these benefits in the comfort of your own home. It's equipped with laboratory-grade materials to ensure safety and efficacy. This kit offers thousands of treatments and is far more cost-effective than clinic visits. Don't forget to use the code in the description at simplyo3.com for 10% off. I'd also like to give a quick shout out to PROMOLIFE. If you haven't heard of them, they're leading the game in ozone therapy. Crafted with care right here in the USA, their ozone generators are top notch. Beyond that, they've got a full lineup of accessories that truly opens up the world of ozone in innovative ways. To support this podcast and check out what they have to offer, you can visit them at www.promolife.com/ozone. And as a little perk for you, our listeners, there's an exclusive discount code waiting for you in the podcast description below.
This is really good for the viewer. Dennis Milhalka, I believe he's a dentist, and he devised an ozone apparatus that can be run with any small ozone machine. And he's got a special stethoscope that goes into the ears, and it's basically ozone proof. It's made of Teflon, which is ozone proof. So there's no destruction of the ozone on the way to the ear. And he showed slides of a very elaborate circulation in the tympanic membrane and the skin surrounding the tympanic membrane, a lot of lymphatics, and the ozone's taken up, and he says he gets really good results with it. The testimonials have been quite good, and I'm really happy that you're adding to this. Comments?
Well, and it really is good to us. And the reason why I went to this, Robert, is simply that we see 50 to 70 patients a day in our office, and we have a small office in Idaho. So I don't have a lot of time to mess with a lot of stuff. And I need stuff that's highly effective, simple, and affordable for our patients here. So it's really easy for me to use this and charge them, $50 for a visit with this, or have them buy a machine. And they love it and they feel great from it. We've got great results every time we've used it. And it's easy to use. I set the patient, walk away. I'm not having to stick veins. I'm not pulling blood out. I'm not doing those procedures that are more complicated, more expensive. So to me, it's kind of an easy way to cheat, I guess what you call it, and get results. And I'm into any way that's affordable and easy to use and reliable and safe. That's
How long do you
really
keep
important.
them on that ear setup when you do it?
15 minutes.
Okay. So the viewer, this is this is a fabulous idea. Again, his system is unique, and that the stethoscope carries ozone through tubing that doesn't destroy the ozone, and whatever ozone may come out and leak into the air is vacuumed up into what we call a destruct, so you don't breathe in the ozone. If they wanted to get that, where do you send them to get it?
Basically, just call the office on Harper Ozone. They can contact us. We can get them in contact with Dennis, and he can do that. That's the simplest thing to do. You can just contact harperozone.com, and we'll get you in contact with him. That's the simplest way to do it. The machine comes with an ozonator, all the stuff it comes with. It's probably not the best machine, but it works really well for that. And it
works great. It's a very cheap machine, but it works well for this.
For that, it works great for that. I wouldn't use it for anything else, but for that, it's great. You can bubble water with it if you want to and do that. So it's got a lot of uses for the patient. And that's kind of an interesting comment, Robert. You speak to that right now is if a patient has the financial capabilities, what would you recommend they use? What things could they do at home to do that? If you were to sit down in importance of order, what would you recommend? And I think an ozone machine is on the top of the list. Frozen water for rectors. That would be the ozone one. The second one is a pulse magnetic PEMF machine of some sort. And that would be my second choice of things to do. And then the third down the line is probably sauna, near or far infrared sauna, and then a vibration table. Those are things that, if people have the finance to do that. I have a lot of patients that put them in order. Yep.
This for the viewer is very inexpensive. And this is probably something I believe you'd recommend. You can probably see therapies. It putting red light therapy. Yes.
Right. And that's on the list down there too.
Yeah.
And so
these are things that
people, the PIMP in that is they get an immediate change from it. The red light therapies you multiple times to get effects. So I want something that's going to do that. But the red light therapy, people ask about that. And it helps some people more than other ones. And that's one thing I also got to tell people. We see the percent of 50%, 80%, 50% results, or maybe 10% results. If they understand that, they're good to go with that. If you think it's something that's a panacea, it's going to cure everything, run if someone tells you that.
Yeah, there's no one thing. Ozone is probably the closest thing to a panacea we have, but it's not a total panacea. It's close. For people who might be interested in this little wrist device, Jean Barnett at Advanced Light Devices, you can also contact me and I can put you in touch with Jean. It's something that I use every day. Dennis, we're talking about what people can do at home. And, I wanted to bring you on for people to hear a totally different viewpoint of assessment. And I know you've seen people who've been to the Mayo Clinic. I have, and I'm using the Mayo as a term for the broad spectrum of the general medicine. That's right. And most of our patients have been to these guys and got nowhere. And then they can't believe it when an ozone injection or certain lifestyle changes their life. What else might you tell the viewer that they can do at home first, and what they could come to you for you do things differently than me?
Questions. That's probably the biggest thing they need to do is question. And I say that's why my fingers crossed here, so I don't forget this. They did some major studies, whoever they are, but there was a study done that actually tried to find out how effective doctors were in diagnosing. And they went through and found that the average practitioner was correct diagnostically 12% of the time.
I would agree.
And then
at best, at best.
I'm just telling you, 12%. Yeah, just put it with that, okay? Mayo Clinic, they said, was at best at 24%. So right off the bat there, those numbers tell you we need to look somewhat differently. So with that said, I'm going to tell you another study that was on shoulders. They took 30 baseball players in New York that were fine. They pitched, they played, they were fine. They said, we want you to go to your orthopedist and tell him your shoulder hurts. They did imaging on all of them, recommended surgery to 85% of them from imaging.
I didn't even know this study. Go ahead.
Oh, it's horrible. But it just shows how bad some of the game is played. And one of the other ones on that, which goes along, is I've talked to staff people that work at orthopedic clinics, and I will tell you the least professional I see at my classes are orthopedic surgeons. I don't see them in my class. I see interventional radiologists, I see anesthesiologists, I see general medicine doctors, I see pain clinic doctors. I never see an orthopedic surgeon. And it's
same in our classes. Same thing in our classes,
Yeah,
Dennis.
same thing.
Yeah.
It's just comical. So a lot of the comments is I make too much money in surgery. I did one orthopedic surgeon. I actually trained at his clinic down in LA. He had 3 clinics there. He did mainly work comp claims in California, which is a racket. I mean, they have a whole system, how they go put them through the game and, these tests and that test. And I had a finger that they'd done surgery that wouldn't straighten back up like this. It wouldn't straighten. So I did a little ozone injected here, finger straightened up immediately. And the finger's fine. So the doctor was standing by my brother there and whispered to him and said, I charged $2,500 for that surgery and I like doing that. And I'm going to charge $50 to do that. I can't do that. That was his actual comment. And so the other one that got me is from staff people that worked at orthopedic offices that I've been around that told me, I said, they would tell the front desk people, make sure you get so-and-so in as soon as possible before their shoulder gets better. And we know 85% of rotary cuff tears will heal to a large degree. But they said, no, get them in before they get better. So, anyhow.
So they can get the surgery.
Get the surgery done. So I think that inherently is a problem. One thing that neurotherapy does that I like is it relieves the pain, restores motion, and then you can do some with deep ozone, things like that, but it frees up that range of motion. And that's probably one thing that's probably a big deal I didn't mention earlier, that if you can't restore motion to an area, it won't heal right. Motion allows circulation to come into an area, and the ozone helps get resilient tissue that reforms healthy, elastic tissue instead of multiple scar tissues when you keep damaging it, like a low back area and spine. So motion is extremely important in healing. So the neurotherapy is good because it causes that increased range of motion. You've seen in my classes when I do people, they can't move, all of a sudden they can move within 2 minutes. So there's a lot of miracles in the body that if we use these tools conservatively, we can see a dynamic amount of changes happen in the positive. Now, if you get a muscle that's totally torn off and not connected at all, you're not going to get that magically to heal.
You need surgery for that, or some way to reattach it.
So I got a video I just released that's going out in the next 2 weeks here on our camera or on our video library. And it's actually one of my medical doctor friends that works with us here. And he was in judo, fell down and did a classic pointer on his AC joint, tore it. So I get a call at 9 o'clock at night. Bridget came down, x-rayed him, and it separated that darn AC joint. And I said, what do you do with this? And I said, if we tape that within 24 hours and put ozone into it, taped it, it came right back together again, keep it taped now. It'll heal together as opposed to most traditional care, which just lets those AC joints heal willy-nilly and have arthritis later. It was just one I was kind of excited about to see the K-tape, and it just sucked that shoulder right back together again. And it'll heal without having arthritis in 10 to 15 years from now. Yeah.
2 points I want to make from what you said. Even in medical school, when I went to medical school, they said that the x-ray of your lumbar spine has nothing to do with your pain or inability to do things. It's true. In other words, your x-ray could look perfectly normal and you're in intractable pain, and your x-ray could look like you're a total train wreck and have no pain. Exactly. And they knew that in medical school. And that's one reason why we also were taught that back pain has a 50% make you worse rate, but that's what the orthopedic surgeons do. And I'm sure, I know you're a chiropractor and an ozone doctor. Your results with back pain are probably going to be well over 85%.
They are. We eliminated 95% of our back and neck surgeries out of the clinic for the last 15 years. And I say that because I went back and looked at our numbers. We were sending 13 to 14 a year to surgery for neck or low back 20 years ago. And when I started doing ozone, that ended immediately. And the neurosurgeon I worked with called me 6 months later. He said, "Did I make you mad? I haven't seen a patient from you in 6 months now." and he told me before, he said, and he's been to my office here. We had a class down here and some stuff before with him. Nice guy. And I said, "I haven't had to send people." He said, "Well, you're the best diagnostician around. So when I get a case from you, I know they need surgery. So I can pretty confidently know that the ones I kept from surgery were legitimate ones that would have went to surgery." So, and we know that by just the testing I've done for years on evaluating spines. So it's interesting also, and it speaks to what you're saying there. I'll mention this, which if you evaluated 5 people out there, 1 out of 5 would have a herniated disc that should cause pain, has no pain at all.
Mm-hmm.
So reasons why we have pain, we're not really sure of. Now, if I have a piece of bone stuck in the nerve, yeah, it's going to hurt like hell. But generally speaking, the body can do an amazing amount if we give it the tools to increase that range of motion and take swelling away. And that's the other thing we haven't talked about much is how inflamed most people are. That's why they hurt all over.
Let's talk about that, because you said something that blends right into this. You said you put ozone in here and it snaps back together. I want to make a statement. You elaborate. Where there's injury, where there's a tear, where there's surgery or an injury, blood vessels are disrupted, circulation is disrupted. You're not getting circulation in, you're not getting oxygen in.
Exactly. So introducing oxygen to those areas is extremely important in facilitating more flow of blood to an area and better results with it. So yeah, you're absolutely right with that, Robert. And I think that's hugely important. And that's why ozone's so magical. It doesn't take a lot. And see, that's the other issue is more is not better. And I'm a proponent of sometimes less is better than more. And I've struggled with that over the years of doing it because I think I've done like 70-some thousand joint injections now. So I've done a lot of joint injections, spinal injections. So I've really changed my attitude of how much to get the best results with less discomfort. Now, can patients tolerate a lot? Yeah, they can. Is it worth making them that sore? Probably not. We don't have to do that. So I'm also the opinion of, really mediate with each patient and treat each patient uniquely to that patient is extremely important. Everybody is not fit in the same framework. And that's really important also in evaluating. Western medicine puts us all in the same box.
Exactly. Hypertension is treated the same way in everybody.
Correct. Right. And that's just the wrong way to do it. Wrong way to do it.
Well, I'm hoping that we're going to see some change with the new chief of Health and Human Services.
It's going to be a long road, Robert. We know that really well. And I think a lot of these companies know they're screwing with people. The FDA knows they're doing it. The pharmaceuticals know they're doing it. They just don't tell you they're doing it. And I think they pulled the wool over our eyes way too long now. So I'm hoping that we get some clear visions on things and see it. How it changes, I don't know. That's going to be a tough one to do because we have 80% of our practitioners are under the guidelines of the FDA and big pharma and corporate medicine now. There's only probably less than 15% of the doctors that are not under that shell. I know in Boise, Idaho, they went and bought most of the private practitioners out and told them you couldn't have hospital rights unless you let us buy you and take over your office. And that's been a big deal in Boise and several areas around the country. And so we see that kind of thing. So with that said, I'll put a little kick in for what we did in Idaho. I don't think I may have alluded to that last month, but our new naturopathic law that I'm under now actually allows us to legally do ozone and biological allograft stem cells in the state of Idaho legally. And we're the first state that allows this broad of scope of practice. And I'm actually writing those parameters for the state. So we have on the state level, at least, that ability to kind of make some changes, I guess is the best word for it. And maybe I'll open that door, and I'll be doing a training for the doctors starting in February. So I'll be doing several classes for the new doctors with the new license in the state of Idaho to open that door. So it should be a really interesting state when we're done with this whole revised system of doing things differently. As opposed to some states are clamping down more. State of Washington, right next to us here, it's disciplined 25% of their physicians, their MDs in the state, and pulled licenses in the last several months, going back to COVID stuff. It's like, are you kidding people?
Didn't Washington have a law that protects unconventional medicine?
No, not the state of Washington.
Wow.
No, it's one of the worst states, right with New York, is one of the worst states.
You know, I got the first law passed protecting alternative medicine in Alaska.
That's why I was mentioning this to you.
Yeah. Wow, I didn't know that. California has a law also that the board has been respecting.
That's good, they have been, but they still push it through some of their pharmacy boards now instead of the medical board. They're jumping down doctors' throats now through the pharmacy board. And people don't realize all those laws lap over. I mean, pharmacy board can take your license away tomorrow if they decide to, but the medical board may not touch it. So you can actually get attacked by the pharmacy boards. And so it's kind of an interesting paradigm there. So our pharmacy board is really well controlled and really open-minded here in the state, which I'm happy with, because there's a lot of rules that are federal laws that we don't have to deal with in our state, and some states have to. The mixing of products, for instance, having a hood, having a clean room, some of the things like that potentially are a problem. I mean, if you take, blood out and mix it, you virtually need a hood to do that if you looked at some of the laws. And that becomes a real, as we know, challenge. And so it's really kind of it's a farce, but it allows them to have a witch hunt and come after people.
Well, I also want the viewer to know that you were a former state senator, correct?
I was. I filled in for a Senate position. So I'm actually got 2 doctorates, a senator, and a minister.
Okay. So you're familiar with the whole spectrum of the corruption in medicine, even from a legislative perspective.
I've testified in 3 U.S. Senate hearings. And I had the head of Regents Blue Shield fly up to my office several years ago, had his head person with me and sat down across the desk. He was so mad at me, he was shaking. And
why was he mad at you?
Because he said, "You talk bad about us. Would you quit talking bad about us?" I said, "Yeah, you quit being," and I'll say this, "You quit being assholes to the patients and the doctors, I'll quit talking bad about you." And he couldn't respond to that because they screwed everybody over. He said, "Will you sign our contract?" Why would I sign your contract? It puts me under contract to do what you tell me to do. And if I take and complain or try to get a talk against it, the final decision is still you. I can't win. Why would I sign a contract with you? So it's kind of interesting. But yeah, yes. So I've testified at high levels over the years.
Well, this whole thing is beyond corruption. Look at what just happened in New York City. The CEO of a major insurance carrier was gunned down, murdered, and there's no excuse for murder. I want to make that clear in my book.
No, I agree.
But there were 3 they found inscribed in shells left at the site. 3 words: deny, defend, delay. I believe those were the 3. So what that's saying is the insurance companies are going to deny you right up front, delay as long as they can, and make you take them to court at your expense to get the money that they're sitting on and earning interest on because they haven't paid your claim. Comment.
Right. I know. The honestly, I think the best thing that could happen is everybody drop their insurance coverage. Don't make any payments for 3 months. But it would force doctors to go to cash then, which we would find that the fees would be much more reasonable. It's like when we do a thyroid panel. Our thyroid panel is $170. And if you go to the hospital and get it, it's $800 for the same thyroid panel. But it's billed to insurance, covers so much of it, and then they pay a copay, which is the same amount of what our charge is. So it's like they just get it right here, they're done. So we do the blood draws here. And that's the kind of stuff you look at. X-rays, price of X-rays. We have digital X-ray here. Hip X-rays here are $60. Hospital is $700.
Oy.
So I deal with that at a really, really tight level with patients here. So people rely on us for almost primary care here. And I have an MD full-time here also. And so we do a lot of things, but it's all cash. And it's cheaper than the charges they get going up there to the hospital.
We are all cash as well, We don't want to have anything to do with Medicare. You go to prison if you don't do exactly the type of corporate medicine that Medicare wants you to do.
And realize I cannot opt out of Medicare for adjustments as a chiropractor. I legally cannot opt out.
Really?
Yes.
I didn't know that.
You have to post everything, so we do post it. But we have
Wait a minute. I can opt out as a physician.
I can't.
Medicare covers adjustments.
Correct.
And you can't say to Medicare you don't want to participate in their system?
No.
Wow.
Yeah, it's pretty wild, isn't it? So, anyhow, this is what you live with. Just one of those dark clouds we don't worry about. And, it's like, I've got doctors that don't accept Medicare patients, but I've treated some of these people for 40 years now. I'm not going to just kick them out the door. Now, we bill them for unbillable services, and they sign a paper on that so we can do our injections or IVs or extra blood work and stuff.
Right. Medicare's not going to pay for your ozone treatment.
No, none of that. No, absolutely.
And you're not going to take a chance charging that to Medicare under some other code.
No. There's some people that did that with the stem cell procedures under a Q code, and they called me and said, "Oh, you should do this and bill Medicare under this Q code. You get paid $8,000 or $10,000." Well, they've been systematically going through and putting those people in jail and making them refund those fees.
Yeah.
They interpreted the Q code in their way where they thought they'd get paid on it. And they did for a while until Medicare went, "Wait a minute, this isn't right at all." So it was a problem. It's what it is.
Dennis, I know you have to be somewhere soon. We've been on for about an hour. I want to see if Lucas has anything to say or question you, and then give you some time to make some additional comments. Lucas?
Yeah, well, first, this is super interesting. I think our audience is really going to enjoy this conversation. Definitely a different approach to ozone therapy, which everyone here is pretty familiar with at this point, but learning a lot of new stuff with this conversation. I do want to just make a quick correction. The inscriptions on the shell casings from the New York shooting was deny, defend, and depose. In case
and depose. Thank
depose. I don't want anyone misquoting us. Anyways, I did have one quick question because you mentioned earlier about resetting the adrenal glands after an injection. I think you said ozone on one side and procaine.
Right.
How do you reset the adrenal glands?
Okay.
What exactly does that mean? That was confusing to me.
Okay. I'm sorry. There was two confusing things, right? The actual test we did with procaine in the neck, we did 14 injections on one side with procaine just under the skin and 14 injections on the other side. And it drained the lymph nodes out. And the one side was totally drained. The other side only drained halfway with procaine. Ozone was way more effective. Now,
Now, when you say drained out, how did you measure the draining out? Can you explain?
There was no swelling in the lymph nodes, no palpable swelling in the lymph nodes.
So the swelling in the lymph nodes went down completely with the ozone and only halfway.
With the procaine. Right.
Okay.
Sorry, that was a little confusing. Trying to cover a lot of stuff and do it. So the ozone, the neuro reset or adrenal reset is around, if you 3 inches down from the brow line and you go around the bottom part of the ribs there, there's a area about this big you can hit. Anywhere in there will do it. And it's 5 spots. We muscle test it before. We find pain on people and places. We tell the brain to be aware of that, and we reset that, and it takes the pain out of all those places we found. At least 80% or more. And it does it within 2 minutes. It goes back up to the rising reticular system, mechanoreceptors, resets the cerebellum, and resets the body's sensory feeling of those areas. Well, a good example of that, I had a lady come in that was in her 30s. She was born in China, and her foot had been curled up under her in the womb. She was 30 years old, and no one could ever deal with the foot and straighten it. So I reset her adrenals, and I reset 2 places on the leg. The foot straightened up with 1 treatment, and it's gone. So that was a memory locked into the norm when she was a fetus, saying the norm is for this foot to curl up. So unless you reset the brain, the memory kept in play there. So unless you disrupted that memory, you keep the same memory. Same with pain. Pain's a memory response. And people can have years of pain, and you reset those systems, and the pain's gone. And it's just a method I found using ozone, very simply, on some key areas that changes people's pain responses and functional responses. What's interesting about the ones I do here is people's urine will change color dramatically for 2 or 3 days. It'll turn almost to brown from dumping all the lymph tissue out. And so it's interesting, when you do those. And it's brutal. It's 14 small injections on each side of the neck. It's one of the most aggressive things I do at all. But the results are astounding every time. MS patients, clearing the fog out of the brain, takes the swelling out of it. Lymph node swelling for people with lymphoma, cancer, things like that. It's amazingly effective. So I don't do it just to everybody. It's got to be that level of patient to do that on. Adrenal support, I'll do that all day long, the adrenal resets.
Mm-hmm. Well, you just said 14 injections in the neck.
On each
side.
At
your classes, on each side. So at your classes, you were talking about thyroid, which was just a few injections along here.
Correct. True.
What are these
on
injections?
Video library, all those places are marked on the video library for that other injection.
Yep.
It's a whole different injection, Robert. It's as long as people have been everywhere, cannot get the lymph nodes to swell down. They got pressure in the head all the time, foggy brain, chronic headaches, and those lymph nodes are swelling. I'll go to that level of doing it. It's not something I do every day, but it's a tool you can have if that patient says, okay, nothing else is getting better, we're going to go to this next level and do this. Yeah, I try to reserve the real complicated stuff, the ones that need it. If I can get by simple, I'll do it simple. I'm into simple.
Well, I want to give you lots of credit for being able to explain to the viewer the situation with the neural memory, and that the nerve actually, we're not talking about the brain here. We're talking about the peripheral nerves remembering things and then spitting toxic information into the central nervous system that dysregulates the body.
Correct. Just wipe that sheet clean. Let it reset again. I've seen it happen. You saw it happen at the seminar there. How many changes you can make with that?
Lucas, you're a layman. Do you understand what we're talking about in terms? It's sort of like my analogy has been most everybody has played a pinball machine. And if you shake it too much, it goes tilt. And this is just taking the tilt out and allowing it to resume.
Right. Yeah, no, it makes sense. I understand. I actually, am tempted to book a flight up to Idaho now and experience this treatment because I have a problem with some inflammation in the sinuses. It's something I found running or jump roping a lot helps clear it out in the mornings, but just when I lie down, I wake up in the morning, it's pretty stuffy, and I've struggled to find a good cure for it.
There's some multiple
There,
cures for it. Looking at
yeah,
you, you can see it
Dennis
looking
has
at you.
one. Go ahead. Tell him what you see.
Well, there's three things I would do. One, it's a chronic inflammation going on. So you're allergic to something you're around. Either you have some mold you're getting around, something setting off, or some low-level allergy stuff. That's the first issue. Which for the sinuses, we do ozone in the nose, PEMF here, and the ear insufflation. Change some supplements, and you probably 95% chance I would fix it. Just saying.
There's another possibility too, Lucas, and this is going to be a rage or a wave of rage in the ozone world, I believe, and that's to nebulize with ozonated glycerin. And we haven't had. Did we do Jim Bridge yet?
Yeah, that was the gel he was talking about, right?
That's right. That's not put up yet. It will be put up in maybe a week or two. Ozonated glycerin is portable ozone. You could put as much ozone in this as I could do in 110 passes, maybe even 210 passes, in this jar with ozonated glycerin. And this was stunning information. And I have given ozonated glycerin to some people with lung infections. In fact, the first woman was one with a really, really serious mycobacterium infection, and she felt better immediately. So that I'm just, since we're talking ozone here, I just thought I'd give you that information.
Yeah, helpful. I will be doing some research, but yeah, this is it seems to be, like you said, the closest thing to a panacea we have. You're covering a lot of issues with this.
Good. And I wanted Dennis on here because he's got so many other ways to skin the cat with this.
That's just it.
And we're
There's a lot of ways to get there.
Yeah.
And some, to me, the jury's still out on the glycerin, but it's interesting. And again, it's another tool to add in the right circumstances. But again,
yeah, I
There's
agree.
no silver bullets.
Jury's out. We're working with it because we want to see what we can push it to. So far, we've been happy with it. We don't have a lot. It's kind of precious to us, but I'm making it as we speak. Lucas, other questions? I know Dennis has to go quite soon.
No, I'm good. I think a second conversation would definitely be warranted here, but this has been very enlightening.
Good.
Thank you, Lucas. This has been fun. I love to talk. I'm sure you figured that out. So, I do a lot of workshops.
You're good at it.
Remember, he was a politician once upon a time.
I got a bridge I'll sell you, Lucas. What kind of bridge would you like?
Something in London, preferably.
Dennis, is there anything you want to? Is there anything else you'd like to share with us before we close?
Well, I thank you, Robert. We've had a great relationship for a long time, and it's been mutually beneficial for both of us, and I appreciate that a lot. Wednesdays, I'll get you to sit down and drink whiskey with me, but that's another story.
That's hard because I'm a vegetarian for spiritual reasons, and on my path we don't drink alcohol either. See if you can find something else.
We'll find something else. We'll do something.
I do drink alcohol-free beer.
Okay, that works.
All right.
Good. I don't drink that much anymore. I just kid people about it, but
I know.
it is
Whiskey and red meat.
Whiskey and red meat.
Well, I'll tell you something. He's a carnivore, and I respect him. He actually goes out and gets his meat. I've seen him carry around a big rack from a moose.
Yeah.
It's the best way to do it.
Yeah.
Yeah, it's pretty exciting. Okay, gentlemen, it's been a good night. I'm going to go eat some dead pork. So that's my secret for tonight.
And I'm going to eat some live vegetables.
Sounds good. Thank you, Robert. Thank you.
Okay.
Lucas. Have a good night.
Thank you both. Thanks for being
guys.
here, Dr. Harper.
All right. Good night.
As we conclude today's episode, Consider the long-term health investment with Simply O3's ozone therapy systems. Designed for easy and safe home use, the Simply O3 3.0 Complete Kit comes with a lifetime warranty and a 6-month money-back guarantee. That's right, try it risk-free for 6 months and experience firsthand the reduction in brain fog, inflammation, and more. If you're not satisfied, receive a full refund. Ready to take control of your health? Visit simplyO3.com. I'd also like to give another shout out to our sponsors over at shopc60.com. If you haven't heard of C60, it's that antioxidant known to enhance mitochondrial function and combat inflammation. Many seeing C60 with their keto and intermittent fasting regimens, seeing a boost in energy and clarity. If you're past 40 and looking to refresh your vitality, explore shopc60.com and don't forget the 15% off code in the description for your initial purchase. Thank you for listening. If you found this conversation inspiring, please share it with your friends, family, and colleagues. Until next time, stay safe and be well.